Hey, welcome to
Doceree Dialogue,
a platform that unites industry leaders come together and exchange ideas, innovation, and insights.
shaping the future of healthcare marketing. So, good morning, Cliff.
Good morning. How are you?
All right, how's your 3 days been?
It's been great.
Yeah.
Tiring, but it's an awesome time. Yeah, it's been a really good week.
Where are you based?
I'm based out of Philadelphia.
Okay, maybe for our listeners, introduce yourself.
Yeah. So, hey, everyone. I'm Cliff Covey, SVP Group Director of Digital Activation at CMI Media Group, overseeing all things programmatic and video across the organization.
How long have you been there?
It will be 11 years in November.
Wow.
Yeah, so quite some time. It's our organization has a lot of people who have spent a lot of time there, and it's awesome.
There are all sorts of partnerships being put together that I would have said, whoa, how did that happen? There's a bit of an explosion going on.
There is. I think it feels like kind of everything's kind of falling into place over the past few years with all of the partners that we work with. And yeah, it's incredibly exciting. And yeah, that was obviously very big news. And yeah.
What are you seeing for clients? I talk to a lot of pharma brand marketers, right? And they're still sort of struggling a little bit with some of the more innovative things internally, selling them in. Are you seeing the same things, or are you guys? I know CMI has always been. I remember Buy Doctor back in the day before data was sexy, right?
Yeah. Yeah. It's a good question. Yeah. So Buy Doctor, now called Empower, obviously a platform that houses a ton of both HCP and consumer data.
Yeah.
From a client standpoint, challenges, kind of the slow to moving innovation. I think there's been a lot of progress in a lot of areas over the past years. We've done a number of sports sponsorships.
Nice.
It's the NHL and other organizations that I think are very exciting and something that we may not have done necessarily historically. I think being in the programmatic space, like we really concentrate on personalization and data. And I do think that creative iterations and the creative to really have true personalization is still a challenge, especially when it comes to things like video, right? We're often serving a very similar video to either patients or HCPs in very different areas of their journey. So I do think the adoption of technology to have more personalized creative is something that I'd like to see continue to progress. And I think that's the biggest challenge, kind of holding back from some of that like true personalization. The data's there. They're doing a great job on the data. I think both on the HCP and DTC side, where we have the ability to create really personalized experiences. I just don't know. I think the creative is the challenge that we're still trying to overcome.
I think part of it is the cost issue, which I think you alluded to just now. If I've got to create 64 different kinds of banners and 14 different kinds of videos, it gets a bit of costs.
100%. But I think that's where technology has to play a place, right? Like I think there's more and more dynamic creative optimization technology that is more turnkey and that we've been bringing forward to clients. And I think we're beginning to see more scaled adoption of that, but I would like to see that continue over the coming year.
Will we see any format changes? I know we've stuck with the IAB formats for such a long time. Are publishers or any partners sort of saying, hey, let's experiment with some new ways of engaging with our customers using programs?
Yeah. I was on a panel here yesterday and I talked a little bit about this. Like, I think the TV is the most exciting place from a format standpoint. And I said, like, historically, the only way to engage your audience on TV was the standard commercial break or a sponsorship of
15:30, yeah.
15:30. And now you turn on your device and you get a home screen and there's advertising opportunities there. You go to a fast channel, a fast screen, and there's advertising opportunities there. If you're going to a subscription or an advertising-based on-demand platform, there's opportunities there. And we can even begin to use AI to dynamically insert sponsorships within content, right? So not even in that break, just directly in the content of it. Someone's talking to their doctor about something, perhaps we could have a brand logo show up, right? And so I think that's really the most exciting space. I think a couple things, like it just gives us the opportunity to engage with our audience on an individual level in very new and unique ways. But I think there's also a really cool creative aspect to this.
Exactly.
I think there's, I don't know that it's made its way to the pharma world, but just the ability to kind of send information to your phone directly from that or have some sort of very unique creative. I think that's the area that I'm most excited about.
But on the data side, you've got your own proprietary data, but it seems that there's an explosion of data companies coming out as well. Are you overlaying or doing anything around that?
We are, yeah. I mean, we have very strong partnerships with all of the core data providers within the space. It is amazing how specific to an audience we can get at this point. I was talking to a client recently about a patient diagnosed within this last 6 months with a condition who has only seen their primary and not a specialist. Like, we can model those type of audiences to, again, really kind of serve those personalized experiences. And that's where those head of content, I think, become important. So we can begin to have the messages that we've talked about.
Yeah.
But also, obviously, I think the thing that's always sitting in the background on the data side of things are the data privacy legislation restrictions we're seeing on a state-by-state basis. So I also talked about this a bit this week, but I think making sure we're getting data privacy right is the most important thing going on in our industry right now. And I don't think that's just for CMI Media Group. I think
it's everyone.
Huge responsibility, because we see the reputation of pharma and is at risk. And we all need to put a lot of effort into making sure we get it right, especially in the absence of federal legislation, where we are kind of a moving target on a state-by-state basis.
I think it's just going to explode. I think the current administration is really trying to push down things to the state level and less federal oversight and more state level based solutions, right?
I don't think
we're messy for us. I think
very messy for us. Yes, and we've put mechanisms in place to make sure we have both processes to identify upcoming legislation, be well ahead of it, to communicate to the teams what this means for health modeled audiences versus geo-targeting versus this, and what we can do in states. And we work very closely with the data providers that we work with to, here's our point of view, here's our thoughts, this is how we need you to change your models or change your data or change your seeds. But then it's also important that we don't only rely, and we have safety controls in place on our side of things to make sure that we're compliant with our point of view on this, and that we're working very closely with our privacy lawyers on the WPP side and things as well. So it's going to be a moving target. It's something that I work very closely with our data privacy lead on every day. But yeah, we need to get it right.
But presumably, I think it'd be more on the patient side rather than on the physician side, right? It really is around the patient.
It is, yeah. I was listening to something recently, but it was like, placing your ads in content and contextually relevant content's great, but placing it in front of the right user is obviously better, right? So in the absence of health modeled audiences, potentially in some of these states, how can we use contextual models, AI-based models, to be much more predictive in terms of, like, someone diagnosed with this condition is watching this, right? Yeah. And I know it kind of sounds like old school linear planning, but I think with the amount of data we have and with the AI available to kind of digest and make sense of that, like, I think the models are just going to become much smarter.
I don't think it's old school linear. I think we are going to have to go back to some of those older principles, right? Because the technology is going to allow us to do that and then use the new formats.
Yes.
So I encourage planners that I work with. I said, look, learn a little bit more about how we used to do some planning. It's not just about the flight. It is not about the mix,
Really.
Are you seeing anything new from an programmatic perspective? We've covered data, AI, etc. Any formats that you're seeing? We talked a little bit about YouTube.
Yeah. I think we've put a lot of effort into the audio space.
Oh, right.
The past few years.
No, sort of.
Yeah. So audio,
Everybody is streaming.
yeah, everybody. It's when you think about podcasts and audio, it's such a unique and intimate experience. I heard an anecdote a while back, but like, podcasters are in people's bedrooms, they're in people's rooms, they're in their kitchens.
Yeah.
It's part of their life, and it's someone they feel
They're in the car. They're everywhere.
It's someone people almost feel they have a relationship with, right? Even though they don't. But I think there's just a ton of opportunity in the audio space to kind of create some really meaningful experiences. And I'm overall just in the programmatic space in general, I'm excited about the type of inventory and better access to inventory. We've done a lot of supply path optimization efforts over the past year, consolidating our SSPs, really taking great control of the inventory.
Good.
But we're also working with our partners on the endemic side of things to discuss what inventory is going to be available in the future programmatically versus direct. On the, we talked about interactive units, but Magnite is beginning to sell pause ads programmatically. And so I think we're going to see over the next couple of years an explosion of just inventory available programmatically that was historically only sold direct. So those would be the two areas that I've been putting a lot of thought into.
I was amazed at, global as well. It's great here, but then you get outside the US and half of these publishers don't even know what IAB is. They have a standard set, right? Are you going global at all? I know you're doing this agility thing in Berlin, right?
We are. Yeah. We have a global team that's expanded pretty significantly over the past few years. It's a great crew over there led by Matt Durham. I think what's very exciting what they have going on.
Yeah.
So far, obviously limited on the programmatic side of things for a variety of reasons, the identifiers, especially with the restrictions around HCP only. So I think our programmatic efforts have been a bit limited to date, but yeah, we've seen a ton of expansion globally from that team, and they're doing a great job.
What's next? What's next? The next year, we're starting to see, just wandering around here, there seems to be three pockets going on. One is around data. Everybody seems to be carrying, I've got this kind of data, I've got that kind of data. The second piece seems to be programmatic into new areas, as well as old things coming back again. SMS with Empiricus, for example, right? Like, that's DMD.
I know.
And we've also expanded as Doceree into programmatic in a big way, right? So what do you think?
I think it's honestly like bringing a lot of that together in the orchestration. So on the HCP side in the past, we've been able to serve very personalized experiences, ingesting data, pushing data out on a daily basis, taking receptivity to message, interaction with previous media exposure, rep visits, if they attended a webinar, things along those lines, to exactly know where the HCP is in their journey and what message, what channel, what experience they should be provided.
Then you can build an audience cohort based on that.
Exactly. And so I think expanding that to the DTC side, I think with the power of the data we have, with the content that we're beginning to be able to build, to me, it's about kind of taking that HCP approach that we've had for so long and really applying it to the DTC side of things and really serve meaningful, strong experiences, and not just, hey, here's this 36, 90% ad of that everybody's getting. It's no, we know where you're at this point in the journey, and we think you're at this point in your journey based on the cohort and the information we have, and we're going to serve a very personalized experience to me. And I think with the AI, with the data, with the technology we have, I think we're at the point where that's a true thing that we're going to see happen over the next year.
It's funny, we announced programmatic, we've got point of care, we've got a data IQ, the data place, but the biggest thing here was the rep in a banner ad.
Yes, yeah, I know. We've seen clients to dip a little bit of their toes into that. It's like on-site reps of full rep on their brand sites. I think that's very exciting. Some of the agents and along those lines it's very cool.
I was like, wait, I've got all this other stuff, and they're like, come on, you get this agentic AI app in this banner ad, it's like amazing. I think overall we're in exciting times. Would you agree? I think it's really changing the way we're doing things at the moment, right?
I love it. I love our space. I'm incredibly proud to work in this space. I've been in the healthcare pharma space since 2007, 2008. I think we're doing meaningful work. An educated patient is a good patient. And I think with the power of the data, the technology, I think we have very exciting times ahead of us. And I'm very cautious.
Yeah.
We work with incredibly smart people.
Yeah.
I don't want to disparage any other industries, but we're trying to communicate really complex messages to really smart doctors, or talk to patients when they're in the most serious and
vulnerable place
in their life. And I think that there's a lot of responsibility that comes into that and creating those meaningful connections. So I'm very, very excited, and bit cautious, but excited.
It takes tremendous intellect and creativity to do what we do in the medical, legal, and regulatory environment we have to live in, right?
Yeah.
Well, that takes a lot of brain power to do that, and to be innovative at the same time.
Yeah.
We've got a minute left.
Okay.
Last question. If there was something that you said, you know what, if I had this in the next 18 months, wow, I would love it. What would you think that could sort of help you go, whoa, this will be awesome?
Hopefully this isn't, I feel like it's a bit of a lazy answer, but coming from the programmatic side, I want all inventory.
Yeah, there you go.
Access to
exclusive to everything, right? Inventory.
First look at all of the best quality inventory. So I mean, I think that's an area that I've been thinking about a lot, obviously, and working with our supplier partner team and others within our organization on, and I'm excited about. But yeah.
Okay. I mean, look, it could be done if you've got the clients and you can provide the thing. Why not?
Yeah.
So thank you so much for taking this morning to talk to me.
It was a blast.
I hope this was good.
It was amazing. I loved it. Thank you. It was a blast.
Have a great week.
Thank you.
Thank you.